A recorder joined.
All right, great. Please take it away.
Buenas tardes. Welcome everybody. Mi nombre es Martiza Chirinos. I am a personal health navigator for Enlaces for la Salud project, and I work for the Centro Hispano community-based organization based in Durham, North Carolina.
Hello, I'm Aleida Espinal. I'm a personal health navigator in Charlotte, Rain. We work with HIV clients here in Rain, in Charlotte, North Carolina.
Next couple slides, Judith. So just a quick overview of what we'll be talking about. Also, I'll be sort of leading the conversation just to sort of outline the slides, but I'll be frequently referring back to the navigators so they can provide their personal experiences, insight, and really provide that really personal touch to what this work has really been like. They are the stars of the program. Any success we've had has been because of all the work that they put in. So I really want them to be able to talk as much as they can. So I'll just sort of give the outlines on the slides, and they'll kind of give all the content behind that. So we'll start with the Enlaces intervention and go into all the different sessions we have. And then we're going to talk a little bit more specifically about mental health and stigma and our client experiences. And these, I think, were the two big themes we saw as challenges working with our community and issues to address and continuously address over the coming years. And then we'll talk about some of the challenges and successes and the sort of lessons learned, and then broadly, where do we go from here? Next slide. These are our lovely navigators. So Martiza, you can see wearing the Enlaces shirts on the first picture on the left, and then Aleida on the radio, and then at the AIDS walk Jeep. So these are the women you'll be hearing from today. Next slide. So the structure, very briefly, so we enrolled newly diagnosed and out of care or inconsistently in care Mexican men and Mexican transgender women. The navigators were trained in strength-based counseling and worked one-on-one with the clients to do linkage to care, support their engagement, connect them to support services, and also deliver our intervention sessions, which we'll go into more detail. We worked with a transnational framework, and that was part of the larger national study about sort of talking about the cultural context of their lives, how does that impact their health care. And the navigators, like they said, were based out of Durham and Charlotte, North Carolina. Next slide. So these were our final numbers. We enrolled a total of 91. So at El Centro, Martiza enrolled 46 individuals, 17 were newly diagnosed, 29 out of care, 42 men and 4 transgender women.
Joined.
Rain, 45 enrolled, 32 newly diagnosed, 13 out of care, 42 men and 3 transgender women. So similar numbers, flipped, sort of newly diagnosed and out of care because of the different structures of the organizations and the different relationships they developed with staff. This is where our final numbers were. Next slide. So session 1 sort of started with the migration story. The majority of our clients are migrants, and that really impacts their experiences with healthcare, HIV, their diagnosis. And so this is sort of broadly the topics talked about, but now I'll turn it over to Aleida and Martiza, and I just want them to sort of share what this conversation was like with their clients, what kind of questions they ask, and how did this impact their relationship with the clients or ability to support their clients. So Aleida, if you want to go first and kind of talk about these conversations and what that was like with you and your clients.
Session 1, we started talking about their experience with HIV, how they found out that they were HIV positive, and also what was their feeling, what they had in their mind, and what was the initial reaction, and how the life has been changing after their diagnosis. And also we discuss about their immigration history, how they get here in the United States, when, how was the experience passing the boarding here. Most of them came undocumented, and what brought them here, what was the goal, and if they have family here. Also, we talk about their ability, strengths, or barriers that they overcame coming here to United States with a different culture, different language, the healthcare system also that is different here than our countries. What else? It was like putting their life like a book when they, started thinking to come here and how they overcome all barriers.
Thank you, Leda. That was great. Martiza, do you want to share?
Yes. Also depend on the person. In some occasion, I just let the person to give the opportunity to talk about how he's feeling about the diagnostics, especially if they are newly diagnostic. Sometimes they are very emotional and just need to speak with somebody, because for some of them it's like it's something that they don't expect, it's something that is very scary for them, and don't have anybody else to talk openly about their feelings. So depending on the person and how he's feeling, or he's very emotional, I just let them to express themselves, and then we try to talk a little bit more about the program, or continue the session. In some cases, we have just to stop, and then in other occasions return to the first session. It depends on how the person feeling. With the person that are already in care and they lost or they was out of care was a little bit different, because in some point they have some experience related with the process to assess the diagnostic. But we talk more about what are the reasons for them to not continue their health care. But it depends more on the person.
Wonderful. Thank you so much, Martiza and Aleida. Next slide. So we talked a little bit about the migration history of the clients, and so this is something that is an ongoing theme throughout the intervention in the sessions, because it continuously impacts their life. And so just wanted to do this little outline of what that conversation looks like. So, are clients still connected to home? How does it continue to affect them? What are their reasons for migrating? How are current events in the U.S. and Mexico affecting their lives? And sort of, like the earthquake in Mexico, people have family and friends, and so are emotional. Some people can't return, but still need to. And so Aleida and Martiza, they would take these opportunities to check in with their clients and ask, how they're doing. Or we had clients whose family members passed away during the course of the intervention. So, again, being apart from their family and friends is another thing that's impacting their health care. So just wanted to give that outline. Next slide. So session 2 goes deeper into the medical visits, so talking more about CD4, viral load, their health history. So besides HIV, have they been to the doctor before? Have they been, had experience with the U.S. healthcare system, and also about their feelings around, healthcare, their medical visits. And so again, I'll turn it over to the navigators to talk more about what this conversation was like, or things that were shared with them. So Martiza, if you want to go first.
That's for some of them was important to ask this because depending on how was their experience with the medical system, they feel more comfortable to continue to healthcare and go to the appointments and have a very good relationship with the doctors or the health providers. And for some are very difficult too because they find out that they are positive in like a hard way. Some of my participants went to the were diagnostic in the emergency room. So they came with very sick and they try to understand everything that is around them and the experience that they have. One of them feel that he lost everything because as soon as his wife know that he was positive, he just left with, she took her daughter with her. So living with the new diagnostic and then face that he's by himself and alone and lost everything, it was a really bad experience for that person. And in general, they have a very good experience with the health system, and for some of them, the beginning is very, very difficult and complicated to understand. And back to their countries, they don't have like a lot experience with the health system in their original countries. That's the thing that I must share with them.
Thank you, Martiza. Aleida, would you like to share?
Yes, after the first appointment, when I met Dan, we started talking about what they learned in the first appointment. How was the communication with the doctor? If they express their concerns, if they ask questions, how the experience make them feel, and if the appointment could be better than the way that it went, because sometimes we, as a Latino, we, get so nervous going to the doctor, and it's not the same like in our countries. And also I discussed the basic about HIV, viral law, CD4, and also the health belief and the health history, that it was important to talk to the doctor about health history, health belief, if he talking about the medication is the way to go now, other kind of natural remedies and all of that. Also, and the second session we talk about the communication, why it was important for them to have a good communication with all providers, the nurse, the social worker, communication with the pharmacy, why it was so important to have a good communication and ask questions. Also, we talk about why it was important to be like with the language barrier, with an interpreter in the room that is not the same, to make questions, how they feel having an interpreter in the room, and how important was to have a good communication, like listening, asking questions, being respectful, making sure that they had the opportunity to talk, to ask the question, because sometimes doctors they don't have a lot of time and sometimes they leave, and we don't make the question that we wanted to make. Also, what to do if they have to change an appointment, canceling an appointment, what to do if they are out of the medication, and that was all about session 2.
Thank you. As you can see from what Aleida and Martiza shared, a lot of it continues to tie back to their home, about being Latino, about culture, and what that means for healthcare. So not just talking about HIV, but healthcare experiences in general, about their identity, and really thinking about themselves as full individuals that should be respected and valued also. And like they both mentioned, skill building was a big part of the work they did. So, how to cancel and reschedule appointments, how to get your medications. And so these were skills that were going to be sustained after the Navigator stopped working with them. So really trying to think about how do their clients become independent. And so that was a big part of their work as well. Next slide. This one was all about social networks. So that was sort of started in session 1, but talking more about who are the important people in their lives, what kind of support do they give them, are they positive, negative, and what are those support systems like in the U.S. versus home. And so again, I'll turn it over to the navigators and think about, what were some of the things that were shared, what kind of support systems did they have? Did they have support? Were they open about their HIV or their sexuality or gender with their support systems here and in Mexico? And just anything you'd like to share about that. So Aleida, if you'd like to go first.
Most of them didn't have a emotional support here in the United States. Most of them, their parents are in Mexico, and siblings are there. We talk about like who was the person in their life in the moment, if they think that they will support them. We talk about the moral support, someone that will encourage them to keep complying with the appointment, with the medication. We talk about the emotional, someone that will listen to them and talk about their feelings. We talk about practical support, someone that could help like with transportation or picking up the medication at the pharmacy. And also we talk about guidance, someone that can instruct them to get educated, like here in Rain, with guiding them, allow with support group, and being always available for them. Social support, like someone that they can, hang out and share life experience. And most of the time they didn't have any extra support here, and the support that they had were people that didn't know that they were positive. They didn't want to tell them that they were HIV positive, and that's something that it was kind of a big barrier for most of them, like building the social support and like trying to have new goals to increase the support, going to the doctor, taking the medication, like mental health. Yeah.
Thank you, Aleida.
Okay. Yeah, like Aleida says, the social support is very, limited for people here. And some of them have very close relatives that they know about their status, but it's like a few of them. Even if some of them have family close or family living with them, they don't want to share about their status because they are afraid that somebody else can learn about that, and it's a lot of stigma related with that. And also, for some of them, they have family back in Mexico, especially parents or mother, and they don't really want to share with them their status because they are afraid that even the parents get worried about them because they don't want to see them like they are sick, or maybe the relatives back in Mexico can think about that they are going to die. So it's mainly they don't want to share their status because they don't want to worry their family back in Mexico. And a few of them have a family here, but they don't know about their status. So it's not like a huge social support, and also they don't want to share with anybody about their situation. Sometimes even when people, like relatives, come to their house to visit them, they have to hide the medication and try to hide everything about the doctor's appointment to nobody knows about their status, or people think that they are sick.
Thank you so much. Next slide. So this one will, this came up yesterday in one of the questions about stigma and disclosure, and I know some people are very interested in that, working with your clients about the disclosure process. And so if you all could share what that experience was like. You know, we had an activity as part of the sessions of like, what words do you want to use? You know, what does that look like in doing and practicing with your clients? So if you want to share of any experiences that the client had actually disclosing and what the outcome of that was, that would be great. I don't know if either of you have something to share.
Well, I remember just one person, and he's very youth, and he want to disclose his status with his mom back in Mexico, and he was living with his sister. So he first decided to tell her sister about his status, and we thought about that first. We see what are the possibilities, what are the advantages to share with her. So when he did that, he asked her sister, please don't tell my mom. I want to tell her by phone, but I want to be prepared because I know that is going to be hard for her. And the thing that her sister did was call her mom and tell immediately her mom that his son was HIV positive. It was like a huge shock for him, and not just her mom. He's saying, all my family in Mexico started calling me and same thing. It was like a really bad situation for him. But because he was, I think that he was prepared in some way, he took some time, but at the end everything was good for him, and finally he can talk with her mom after like 6 months, and everything was fine at the end, but it wasn't the way that he wanted to share with his family. So, but it's something that is very, very difficult, and most of my participants, they don't want to disclose with anybody.
Thank you, Martiza.
I have few clients that they disclose to their family after the intervention, and I remember one of them when he came to me and he said, "Oh, I told my mother and my sister," and I was like, you were ready. I was kind of in shock because he was one of them that I was so nervous to disclose, and all his family are supporting him, and he even disclosed his status with his boss because he was having kind of issues to go to the appointment to be off the day that he always schedule, and he disclosed it to his boss, and they started supporting him and making things easy for him, giving the proof of income easy to the letter to bring to the Right and White program. It was like something very, very nice. I have a client that he was diagnosed in South Carolina, and he moved here in North Carolina because he didn't want to tell his parents. He's a kind of like mama's boy. He's the only child in the house. And now he's going back to his parents' house, and he's going to disclose to them. And I'm so excited about him because I know that they are going to support him a lot. And I have other clients that they are not thinking to disclose. One of them, he told his mother in Mexico that he was gay. He wanted to say that he was gay first, and the mother just said, "Oh, don't worry, you're going to be cured." And then he got like panic, and he said, "No, I'm not going to tell her because if she thinks that I'm sick, that being gay is a illness, she's not going to understand." And most of my clients, they don't want to disclose to their family that are in Mexico, and they don't have the possibility to go there. They say like, why if they're going to think that I'm going to die because they are not educated. They're going to be like worried every day about me, and I know that I'm doing good. I'm taking my medication, and there's a lot of good things. And
no, but I can eat. I know. I didn't buy it. I was asking first. No, I think you want to go to Walmart.
Right.
Oh, yeah.
Thank you both. That was very, very insightful. Appreciate that. We're in the interest of time, we're going to skip the next couple of slides and kind of delve into mental health and stigma in our clients' lives. So you can skip a few slides ahead, Judith. Thank you. What are the next ones?
Hi, Joaquin, we do have a question.
Yes.
And I have someone who says, what type of tools and materials do you share with your clients to take with them when they go see their parents?
It's a little hard to hear you, Judith.
Yeah, I'm going to ask if folks are in a noisy spot, you can please mute your phone. You're hearing a lot of background noise. All right. Can everybody hear me?
Yeah. Now.
Yes.
Okay. Sorry, I had to mute someone manually. So the question was, what type of tools or materials do you share with your clients to take with them when they go see their parents about disclosing, or maybe a family member?
So we really don't give anything to them. At the beginning, we think about to have like a manual or a workbook to give to them to bring to house. But they don't want anything that in some point somebody can find out and say, oh, why do you have these papers here? So the thing that we try to do, it's my experience, is working with them in the session and using the material, like showing them pictures or everything related with how the virus works, or how the medication acts, or how it's important to take the medication. And with the disclose part, we have like a couple of exercises as like a role play they can do, but are we giving anything because they don't want to keep anything with them, especially because some of them live with other persons, or they don't live alone. They share apartments, or nobody in the house know about their status. So we ask if they want something, but usually they say no. It was my experience.
I think
one of my clients, I forgot to say this, it was so nice that he brought his girlfriend here to disclose with us, and he wanted us to educate her, and that's something else that we talk about. Then if you feel like you are not ready, you want to go in the session again, or you want me to be there, we can do all of that. That was.
Yeah, I think the navigators have a manual that they use for their sessions and things, and has activities in there. A lot of their tools are very much conversation-based, so helping the clients practice the language to have these conversations. So I know one of the activities is sort of going over very common myths about HIV. So letting them know, like, if people have these questions or believe these things that are wrong about HIV, here are ways you can talk about it. So really trying to, help give the information and knowledge to the clients who they then can share with people around them without having to fear that they will accidentally disclose because they have materials around. And I know that was a common thing. So thank you. That was a great question.
Great. Thank you. So we have a few more questions regarding that, but I also want us to give us a chance to kind of see the rest of the presentation before our time is up together and still have a little bit of time for questions. So if you have more questions, please add them to the chat function, and I'll be sure to pass them along in a few minutes.
Okay, great. We'll try to be brief with the next slides, and I know these will be on the website, so people can feel free to go into the content on there as well. So next slide. And so these are just some big common themes that we saw in our clients, is how mental health is affected, or how stigma comes out in the client's lives. So, there's shame, there's depression, fear, isolation, social support, stress, and discrimination. And there's sort of like subcategories within that. So it can be discrimination, can be race-based, residency, occupation, gender, and these all kind of, it's circular. They all kind of build off of each other in really harmful ways. And mental health is definitely a big common issue with our clients' lives, and also something very hard to navigate in terms of, like, there's not many resources, especially bilingual resources. Next slide. And so taking those sort of broad categories, it did go through and list very specific ways that these are all experiences our clients face in terms of, like, how intimacy to trauma, stress, isolation, all these different ways that they personally experience stigma and how that impacts their mental health, and then, affects their engagement with healthcare. So I can let you all read that, but if Aleida and Martiza want to share anything about, trying to support the mental health of their clients in any way, or what that looked like in those relationships.
Mental health is a challenge here in Charlotte because the problem is that we don't have a bilingual mental health provider that I work with Ryan White, and the private practice is very expensive for them. My clients that are bilingual, I was able to help them here, and we have a mental health program but all of them that they are monolingual Spanish speaking, it was so hard for me. Sometimes I used to laugh with them, saying like, I'm not a mental health provider, because they always thought that I was the one that I was, had to give them all advice and everything, and that was a huge challenge for us here, and it's because of the lack of the bilingual professional in mental health here. We have a lot of mental health providers in Charlotte, but private practice, now with the Ryan White program, that is the program that we work here. And but I don't know if it's part of the culture also, because most of my clients, they have been doing so good, like mentally, trying to do their best, focusing on their family, their job. Few of the one that are cool, benefit for the mental health, are the one that unfortunately I didn't have the chance to help them because of the Spanish provider. I couldn't find one here to refer them.
For this area, especially Durham, Raleigh, and Chapel Hill, it's a little bit different. We have an organization that is called El Futuro, that they have mental health services with bilingual personnel. They have a office in Siler City. Also, they have one in Durham. And they offer different services. Also, they have like a walk-in clinic. We also have some providers in Raleigh that they share like a small fee, depending of the sliding scale. So we have more services, but the thing is, it's really hard to convince the participants to take advantage of the services. They find a lot of excuses to go, and it's something that we can do for them. So if they want the services, they have to call, they have to go. We can do the appointment for them. And a few of them that utilize the services, they feel that they are really good, and it's something that they help a lot. Even in the Wake clinic, they have a psychologist there that if they want, they can go to ask for their services, and she's bilingual. But it's really hard that people ask for the help, and I think that it's very cultural. We don't used to ask for help, and also is when I ask them, they say, "Oh, I don't have time. I have to work. I have to lose almost a day to come to the appointment, so I can afford to ask for more permission to go to see the mental health specialist once a week or once 2 weeks or whatever they have the appointment." And we have a lot of people that have alcohol abuse, and also they are really against to ask for help and also to participate in AA groups. So it's a big issue, but it's also, I think it's more like cultural that we are afraid to ask for help.
Thank you both. That was very helpful. Next slide. I think the next 2 slides are a few quotes from our clients. I'm going to skip through them, and again, y'all can read this on your own, but wanted to give sort of insight to some of the emotions going through our clients. ahead. Next slide. You can skip a couple. Okay. So intervention challenges. So a big thing with our out-of-care clients was that, we can connect them to care, or we can get back in contact with them, and the navigators would put in a lot of work to contact these clients, tell them about the program, and maybe that would be the thing that made the difference in their lives to stay engaged in care. But with working with them, there was a lot of the same barriers that existed that first caused them to fall out of care. So transportation's huge. It's rural. Most of our clients are undocumented, so there's a lot of fear about driving. And then also work. And a lot of them work out of the state for long periods of time, or can't take time off of work or their schedules and things like that, and also, again, their residency status. So trying to work around these structural barriers was difficult, definitely, and there's only so much you can do to address those. Again, stigma related to gender, sexuality, and HIV status were brought up a lot, as preventing them from engaging in care, and sometimes facing the reality of their diagnosis. Again, as they both mentioned, there's a severe lack of either sort of culturally focused or Spanish language resources and healthcare staff in North Carolina. So we have a huge immigrant population that very rapidly grew in North Carolina over the last 15, 20 years, but a lot of that community did not transfer into staff at the healthcare clinics. So we have a huge community that needs resources, but not bilingual staff, or even if they are bilingual, not from the same culture, which is very helpful, which makes a big difference in our clients' lives, our community's lives. So seeing that Enlaces has been successful, that having these conversations around your home, the migration process, about talking about healthcare beliefs and culture make a difference in our clients' lives, that this is a great way to encourage engagement, to address a lot of these issues that is not happening now in North Carolina. Next slide. And then successes. So our navigators are really great in making really key connections with staff. So, they had really great relationships with either providers or disease intervention specialists who would make referrals directly to our providers. So they would find someone that qualified, they call them directly, and they had a really great communication back and forth. Our navigators would sometimes go to those initial appointments with the providers, talk, and then, when the provider needed something regarding the client, would contact the navigators and ask for support. So there's very much a back and forth communication that benefited the providers, our clients, and the navigators. It did take a lot of work, sometimes reminding different clinics and staff that this is a service, this is a resource that is free to the clients. Our healthcare staff is overburdened at clinics, and so this is sometimes one more thing that they need to do or be reminded of, and so that does take continuous work to remind them of that. Flexibility with client schedules was necessary. A lot of times they met with their clients in the evenings and on the weekends. Phone calls, they text very, very frequently with their clients, and those were all ways to stay engaged, to support their clients and work around their schedules. Again, as we said, holistic approaches to the clients' lives established a deeper level of trust. And both of our navigators are migrants and have shared that was a connection they could make with their clients, that they had a lot of shared experiences. So it's not just language that is sometimes the key. It's also about culture. It's also about shared experiences. So I'll give the navigators a chance to also offer what they felt may be difficulties or some of their approaches that really worked with their clients.
I think that the trust, that we build help, building the positive relationship with them was one of the things that helped me to be successful with this intervention. Most of my clients are undetectable. They are taking the medications. They are compliant with their appointment. They always calling me to renew their ADAS. We have a lot of things like in common with the language. family, religions, and that I think that the building the relationship was one of the most important things for me to work with them.
Yes, it was the same for me, and also the ability to take their calls anytime or receive the message because they want to keep their appointments, and if something happens and if they want to change the appointment, sometimes they don't have enough time to call the clinic and wait to the receptionist made the appointment. So I was the person that helped with that. And also it's important because most of the participants come to the clinic, but they come from different cities, and some of them work out of the state. So sometimes they go to Florida, Atlanta, South Carolina, and they try to keep their appointment, but if something happens, they call me and say, oh, please reschedule my appointment because I am out of the town and I don't want to miss the appointment. That is the truth and the relationship that we create during all this time. It's not just then. Sometimes I receive calls from the family, the relatives, or if they need something, or even if they have the opportunity to come to the clinic and they want that in some way I can help them with some paperwork or something, they call me. That's the thing that we create with the program.
And to add really quickly, I think a really quick story of that trust and relationships they've built with their clients was that one of the clients had fallen out of care. Our navigator had not heard from them in a few months, and then they get a call randomly from a number they didn't know, and it was their client who said, sorry, I've been gone, I was deported, I just got back to North Carolina, I wanted to call you. Mm-hmm. And that just shows how much trust they have, how much they can rely on the navigators to say, I just got back, wanted to let you know I need to get back in care. And that's all the work they put in and really building those relationships. Next slide.
Don't forget the WhatsApp app is very important.
Definitely. That's a key tool. So I'll leave this just here to think about, but then I'll open up for questions because I know we don't have much time and I know there's lots of questions. So, Judith.
Great. Thank you so much. So I guess turning back a little bit to when you all were discussing disclosure, Fran Ricardo in the chat function asked, what % of parents have been accepting of their status, I guess in terms of disclosure, and what has made disclosure successful? So in the clients you all have worked with.
My clients, the ones that are disclosed to their parents are their parents are here in the United States. They are not in Mexico. That was something that was important. And also, they are like educated, more like open mind. With my clients, the one that are disclosed to them, they are gays, and first of all, they were accepted as a gay, and I think that helped a lot. And also something that I always told my clients: be ready, be prepared, get educated. Before you told them, tell them what is be undetectable. Know all the fact about HIV before you do it, and because that way you can answer all the questions. And that was my experience with my clients that are disclosed to the parents.
For me, I say just two. One was the one that I told you that his mom was in Mexico, and the other one.
Want me to read something?
and the other one was he was
but I'm not doing this.
he has a brother that also is HIV positive, and he lives in Mexico. So his brother is like 20 years that has been diagnostic, and he say, I know if I told my mom, she is going to understand really well, because I have already a brother that he is positive. The others don't want to say anything. Some of, because Aleida say they don't want to preoccupy or that her family worry about them, even if they don't see them here. They live in Mexico. One of them is they don't want to say anything, because as soon as he say to his mom that he is gay, the mom threw off from her home. So he say, no, I don't want to say anything, because it's just I say that I am gay. If I now say to my mom that I am HIV positive, she's not going to talk with me anymore.
Great, thank you. And I think we have time for maybe one more question. And the question asks, does WhatsApp have GPS? We're just always concerned about disclosing a person's location, especially when we're thinking about like immigration and customs enforcement, or that information. And I don't know if you all know.
Can you repeat it, Judy?
Yeah. So if using services like WhatsApp has like a GPS tracking where they can share the location, where it can track locations.
No, the WhatsApp is good because a lot of my clients, they use the Wi-Fi to communicate when they don't have, service. And that's, a perfect way for them to communicate. They just, get Wi-Fi in any place, and then, send me message. And yeah, but it doesn't have like a track like that. I have I always delete all my pictures. I have my work phone that is, confidential, and the WhatsApp, I never had a problem using WhatsApp.
Yeah, I use mainly text message, and before that I use the phone or text them. I always ask, I think that is in the one of the first session that we ask them how we can communicate with them. It's okay that I text you, it's okay that I call you. And we try to be very, very careful, so we don't say anything that can compromise their identity. And in my phone also, I have like the identification that I have for them is with numbers. And so we try to be very, very careful with that.
Great, thank you. And I think that's we're right at 3:00. So I thank both you, Aleida and Martiza, for presenting today, and also Joaquín for helping moderate today's webinar. I also want to encourage everyone to join us for our next webinar, which will be in the new year. So it's my first mistake with the date already while we are transitioning into 2018. So it will be January 17th, 2018, so next year. And we'll have Dr. Valeria Cantos, who is the assistant professor in the Division of Infectious Diseases at Emory School of Medicine. She's going to be sharing with us research that she's been doing around Latino youth MSM and what risk and prevention looks like when in these cross-cultural dynamics in Atlanta. So if you have any questions, you can email me, or if you want to share your research as well. But thank you all for joining us for our second installment of our Research Spotlight series. Thanks, everyone.
Thanks, everyone.
Thank you.